Yeah, so we decided to still that picture or keep it still on the screen so that you get to know how it felt, and it brought a lot of nostalgia. Well, Charlie, as someone said, this very incident will haunt him for the rest of his life. Look, I was crying that day. I mean, literally in tears, thinking, how could we have missed that? But, you know, I don't play football, right? That was a good time. The 2010 World Cup was good. You all remember that feeling, that Africanness, when we're all one people. I wish it was this time, so that when we tell people wear face masks, use sanitizers, and keep socially distancing yourself between or among each other, you'll get to know what is real. And that is why we want to do the next conversation. We'll be speaking to Dr. Adelaide Appiah, and Dr. Letitia Adelaide Appiah is Executive Director of the National Population Council, but more so we'll add microbiologists, also integral in the testing of cases, etc., works with the University of Cape Coast. And Dr. Samuel Esiembedu will be joining us. We'll have a comprehensive education among ourselves about now that the lockdown has been lifted, what we need to do to make sure that we keep related issues or guidelines within ourselves and in check so that we're safe. But let's update you, the latest figures worldwide, and we'll take you through what that Center for Science and Engineering has for the Johns Hopkins University. And it's the main portal that you can get all the latest update as far as this is related. And we have total number of cases, 2.4 million we have now. 2.4 million cases, and it's still the United States of America inching close to that 800,000 mark, and Spain follows with 200,000, Italy 181,000, France 156,000, Germany 147,000, United Kingdom with 125,000, Turkey 90,000, and China still just remaining, you know, since February, just been crawling. They're not moving. They're like tortoise now. And it shows how massively they've been able to put the disease in check at 83,000, same as Iran. And I tell you, this is how the world map of incidental cases looks like. So you have sitting in the middle Africa for our perspective. We always do it this way so that you get to know. And then the United States is now the epicenter of the disease in the world. We have Europe with the red dotted circles, big as it is, just beneath. The North American continent is Latin and South America. You have South America there. And then you have far away, you have Asia. It used to be China, topmost, India, and all those countries also in there, but it's all in Europe at the moment. And then North America is at its peak. If we zoom in closely, you get to know that the world's case of 170,000 deaths is for good reason, because it's the United States of America where you can find the bulk of the cases now in terms of the deaths that have been recorded. They have 42,000 deaths. So far, it's New York City in New York State that's leading with some 14,600 deaths. And you find that Mayor of New York, Cuomo, would always be giving live updates there. The United States of America, you take western section, it's widely covered in red. You have Dallas, Houston, you have Florida, you have Georgia, you have Atlanta, Nashville, Charlotte, you have Indianapolis, you have Milwaukee, Chicago, Detroit, Cleveland, Buffalo, and St. Louis. But you come closer to Norfolk, Richmond, Washington, Philadelphia, and New York, up to Boston. I tell you, all covered in red. Now, they have the cumulative cases, total recoveries being 72,000, but we have to go to active cases currently, active cases, and they have the numbers, United States of America, the active cases, all there as you can find in those numbers. very much so, just within the 600,000 mark. And so far, a good thing that the United States has been able to do is to do mass testing. And they do it on the minute or the go. And that's what we have also been able to do. And that's what we have to give credence to the various science people who are leading this as experts, those who do the talking, the engineering also in the laboratories. We have to, because in the United States, in New York alone, they've tested over 630,000 people. Okay, you go to California, 290,000 people have been tested. In Florida, 270,000 people have been tested. In Texas, they have 190,000 people tested. In New Jersey, 178,000 people have been tested. And in Massachusetts, they have 169,000. And it follows to Pennsylvania, Illinois, Louisiana, Washington, and the rest of the states in there. Now, it is because they need to know what the actuals are. Those who keep spreading need to be checked, and so when you're tested, then you get to know whether you have to self-isolate, quarantined, and for purposes of treatment, then you get the right sort of treatment. This is all science, or something that you and I could easily understand. That is why when the experts tell us that we have to use the nose masks, the face masks, etc., we should be. But now let's return to the active cases we have. Let's go to the cumulative confirmed cases so far, and then let's go to the world map. Now you come closer to Europe, and this is the European map, and it's all there, all red. It's where let's go to the UK, where I have my good friend Benjamin Kojotu-Formane, who lives quietly in his London home. It's okay, cool, you know. But it's also because they have a number of cases so far. The United Kingdom, you go there, even though Ireland, etc., they're all recording cases. Let's go to the UK, and you go to the UK, they have all these number of cases that have been recorded over the period. And they have confirmed cases, 124,000 cases. Now, death so far recorded has exceeded the 16,000 mark. The United Kingdom, UK, and they even have seen some flattening of the cases over the period. So they're seeing some light at the end of the tunnel. But it's all about caution. I'm just told this morning that the sun is up, but it also means that there's a temptation to go out, etc., because they love the sun, you know. When they're entering the summer, then it means that it's a time for them to get some heat and tan their bodies. But it's all about making sure you get a caution. Now, let's go to Africa. Having looked at the UK situation, let's go to Africa. And, you know, the cases initially started, we had Egypt, then moving to Algeria, and just the North African belt, we had Morocco, etc. Now, every part of the continent is awash in red, and this is where you can't get it. So you come to Ghana, and it gives you real-time data. And it's where we have, and so far, you have the confirmed cases, etc., hitting, and the deaths now recorded as we have it exceeding the numbers that we have. But if you want to get all the latest update, it's not only the site that belongs to the Center for System Science and Engineering of the Johns Hopkins University, but myjoyonline.com. You go to myjoyonline.com, they give you all the comprehensive update that you need to know. Case count Ghana, confirmed cases, those that have been tested, those that have recovered, the fatalities so far, and real-time news from the COVID-19 team of government and all the experts that need to know.